DHT or dihydrotestosterone is the hormone which is the active hormone responsible for hair loss in males especially. Now, how? Because every male will have testosterone and every male will have DHT, but everybody will not lose hair. So your genetic expression or your genes decide you will have those receptors which will detect DHT in your hair or not. That's why people with family history of hair loss actually lose hair, because they have certain receptors which detects DHT in your body and actually makes you lose hair. Now, if you're losing hair and it's a genetically prone to lose hair, there are medication which can be done which can delay or stop the work of DHT. These medications are very well known and it has to be taken under doctor's guidance.